Creative arts therapy at Houston Methodist Willowbrook Hospital means implementing music or art therapy into certain patients' treatment plans.
And for one mother, it's made all the difference during her son's NICU stay.
Oh, he is a fighter. He came out with his fist flailing.
You may have heard that playing music while pregnant can help your baby develop, but music may actually play a bigger part in development after birth, especially for premature births.
It means a lot because this is hardly a homey situation in a NICU setting. And so having the ability to bring that music piece into it, it makes it feel more comfortable.
Baby Hugh was born at 27 weeks, only 1 pound, 7.6 ounces. With the help of music therapy, he celebrated his 100th day of life, weighing 7 pounds, 8.6 ounces.
Looking back at pictures, my husband and I are in awe because his fingers used to barely cover our fingernails. He's had a lot of his major milestones here.
Hugh continues music therapy sessions at Houston Methodist Willowbrook Hospital, and his mother, Shayla, is thankful for the program.
It's therapeutic not only to Hugh, but also to parents, because there's a lot of stressful things that happen in the NICU. It's not all pleasant and wonderful, right? There's medical procedures that have to happen, and so whenever we have Hannah here, she is just a calming presence. Look at this state of relaxation.
And here with us now, that calming presence, Board Certified NICU-Music Therapist, Hannah Mata. Thank you for being here with us.
Thank you so much for having me.
That is incredible to see that and to see the baby reacting, right, and kind of engaging. And tell us about music therapy, because if someone, hasn't heard about it, what is it like?
Sure. Music therapy is the clinical use of music in the medical setting or in other settings as well. It's used to meet physiological, physical, and emotional goals. And it happens within a therapeutic relationship with a board certified music therapist. And you can see us in the hospital setting, you can see us in the school systems or with hospice. With Houston Methodist, with CPAM, we have a music therapist at all of our network hospitals, and we have in multiple different units. And it's an amazing thing to see music have an effect on every patient that you see. It's such a beautiful experience. And yeah, so
what are some of those goals? What are we trying to accomplish with the music with regard to a baby that's been born prematurely in this case?
Absolutely. So when babies are born premature, their nervous system is really underdeveloped and they're hypersensitive to any sort of touch or sound or movement. So whenever they have the slightest touch, it can be painful for them. Oh. And they have to have round-the-clock care every 3 hours with the nurses. And so one thing I do is try to help improve their toleration of stimulation and reduce their pain during procedures or even routine cares. So I do co-treatments with nurses while the nurses are changing the diaper, doing their heel sticks, whatever routine procedures they're doing. I'll be singing lullabies to the baby. I sing in the mother's native language, whatever that may be. I've had to sing in foreign languages to the babies. And also preferably the mother's voice range. And if I don't know the mother's voice range, then I usually will sing higher to the babies. And that keeps them calm. It stabilizes their nervous system, so they're able to stay still and relax, and it also maintains their vital signs as well. So I often will walk into a room and I'll see a baby that has a really high heart rate, they're tachycardic, or they're breathing really fast, they're really stressed out, and I'll start singing and immediately the heart rate goes down. They go into homeostasis, they're relaxed, they're smiling when before they were in pain or stressed. It helps them gain weight. Babies that get music therapy gain more weight than babies that do not, research shows.
Wow.
And helps them go home sooner. And because they're less stressed, they burn less calories, and that's why they gain more weight.
Yeah, that baby fat.
Yes.
You had talked about wanting to do music as a profession, but you also wanted to do healthcare. And when you found out that you could do both, that there was a combination, tell us about that moment. When did you learn about this field?
I learned in high school. I was very interested in entering the healthcare profession, but I love music so much. I'm a vocalist and a singer. I play multiple instruments. And it's really just my heart and soul to provide music to others, and I love performing to others, and I want to help people so much. And this just combines all of my interests. I'm interested in science, research, neurology, psychology and medicine, and I'm able to be a part of a healthcare team while providing music to the patients, helping them meet their clinical goals.
It's incredible
So-
how quickly you see the difference too, right? And
Oh,
each and every
yes.
time you're in there, it's like, this is working and I can see it. Can you tell us a little about the Center for Performing Arts Medicine and what that is?
Sure, it's a center that is hospital-based with Houston Methodist, and it began as just an outreach to the local artists in the community. So it began with physicians treating the ballet for the Houston Ballet and the Houston Symphony, and then it grew to include adding arts integration into the healthcare setting. So they started hiring music therapists to be in like the ICUs, to be in the psychiatric unit, and it has started to grow. And music, as music therapists, all of us have our special interests and different trainings for different things. For me, the NICU, I had to get postgraduate training to work in the NICU because it's such a vulnerable population.
Right.
So with that training, I was able to work at Willowbrook because they had the largest NICU. So that's what the location I'm at. And so yeah, it's just grown. We have 20 music therapists now. We have an art therapist as well, and we're all part of the clinical team. And we work for the hospital, we work for Houston Methodist, and it's just been an amazing thing to see how the arts can impact the clinical care, and it helps also the staff members too. You know, whenever I'm providing music therapy to the babies, nurses will often tell me they feel more relaxed. They feel calmer, they're less stressed.
Yeah.
Even parents too, when you know, they're seeing their baby and it's their turn to do their cares, and if I'm there and I'm providing music, everything goes very smoothly, and the parents have a lot less anxiety.
The music changes the
It
energy
does.
in the room,
It
doesn't
does.
When
It
it's the
shifts
right-
everything.
yeah.
Exactly. Hannah, where can parents learn more if they are interested in learning more about you and your team?
Absolutely. You can go to Houston Methodist and look up Center for Performing Arts Medicine online and learn more about our program. You can also go to musictherapy.org and just to learn basic information more about what music therapy is, because we treat all different ages, all different diagnoses. And you can also go to the CBMT website, and that is the Certified Board for Music Therapy website. If you're interested in hiring a music therapist or having your child or loved one see a music therapist for the specific diagnoses, they can go on that website and they can find a local music therapist to start having that clinical care.
And it sounds like there are many age groups and
Oh, yes.
many different things that people deal with where music can help.
Absolutely.
So that's a fantastic place to start. Thank you, Hannah.
Hannah Mata, the calming presence, NICU music therapist. Thank you for being with us.
Thank you
You
so
could
much.
just come in the mornings and play before
Can
the
you set
show.
us up for this? Yes, calm us down.
Thanks for being
Thanks,
here. Really
Hannah.
appreciate it.